Hello, my name is Robin Landwehr, and I am a licensed professional clinical counselor at Spectra Health in North Dakota, which is a primary care setting that includes integrated behavioral health services. In this video, we will explore how to conduct a warm handoff for patients who may be struggling with alcohol use disorder. A warm handoff is a referral from one provider to another where the patient is ideally present when the referral is made, whether this is a face to face handoff or if the referral is made by phone or via telehealth. For patients who may be interested in addiction treatment services, a warm handoff may mean the difference between a patient who attends appointment and one who does not. If a patient is motivated to access treatment for alcohol use disorder or other healthcare services, it is important to get the patient into treatment as soon as possible. Having to wait can be frustrating, and the person may be feeling unwell and may be experiencing withdrawal, or they may start to experience ambivalence and decide not to go to treatment. Whatever the PCP office can offer to minimize the barriers for the patient will increase the possibility of a better outcome. It takes a lot of courage for someone to acknowledge that they have a problem. You may be the patient's only advocate by the time this is discussed, providing an opportunity to create a non-judgmental environment that encourages the patient to accept help and offers a clear path to do so. Research has shown that patients are more likely to speak with a behavioral health professional if they are integrated into primary care and available to speak with them immediately. When it comes to being referred to their PCP, to a treatment facility outside of the clinic, many patients will not attend the appointment that was arranged. Unfortunately, not all primary care clinics have the resources to have a behavioral health provider on site. For those that do, there are many resources available for best practices for integrated behavioral health services that include addiction treatment services in primary care. For those who do not have an internal resource, the next best option is a warm handoff to a community agency that gives the patient the sense that it is a professional partnership created in their best interest. Sometimes this can be done face to face, but quite often the referral is conducted over the phone or via telehealth. While most providers might agree that warm handoffs are ideal, it may not seem realistic from a primary care office perspective. On average, PCPs spend about 18 minutes with each patient they see every day. That is not a lot of time to conduct a thorough assessment of the problem and make the best recommendation before moving on. The idea of conducting a warm handoff to an addiction treatment specialist may seem impossible or even unnecessary, and simply providing resources should suffice. But as mentioned earlier, patients who struggle with alcohol use disorder may be particularly vulnerable and anxious about seeking treatment. They may have a co-occurring condition like depression that makes it even more difficult for them to reach out for help. In addition, patients who struggle with alcohol use disorder often have some other type of chronic disease, like cardiovascular disease or diabetes. Because of this, a collaborative approach to treatment that includes the primary care provider and addiction treatment provider may literally be life-saving. Here are some suggestions to get warm handoffs started in your practice. If possible, assign a staff person who is willing to be the coordinator for these types of referrals. This could be a nurse or a medical assistant who is willing to learn about addiction treatment services in your area and the best methods for referring patients to them. The coordinator will ideally contact the referral site with the patient present to arrange services. Some agencies are closely located so that a coordinator can literally walk the patient to the other agency. But most of the time, the referral will be arranged by phone or via telehealth with the patient in the room. Coordinators do not have to manage an exhaustive list of referral sources. Having a few good contacts within relevant organizations can be much more helpful than providing a patient with a written list of organizations that is never updated and is overwhelmingly long. Instead, the PCPs can determine what type of referrals would be most helpful, and the coordinator can begin making the contacts. Some referral resources could be inpatient or outpatient treatment services, withdrawal management services, previously known as detox, homeless shelters, and community recovery groups. Making these connections with the patient present can help them feel much more comfortable about the referral and increase the likelihood that they will follow up on the referral. Primary care is a great starting point to initiate treatment in a medication first model of care, where the PCP prescribes medication for opioid use disorder or alcohol use disorder as a low barrier first step toward treatment. From there, if the patient is interested, the PCP can initiate a warm handoff to an addiction treatment provider who may provide addiction counseling services or other types of support for the patient. A warm handoff in this situation could begin with a phone call while the patient is still in the clinic, explaining that the patient is interested in services. Warm handoffs are sometimes bidirectional once a relationship between agencies has been established. For example, a counselor at an addiction treatment facility may refer their clients to the primary care clinic after a patient reports they may have been neglecting their physical health due to their addiction. When addiction professionals refer patients to agencies, they often select those who have a reputation for being non-judgmental and supportive of patients who are struggling with alcohol use disorder. In this scenario, the primary care clinic and the addiction treatment provider may choose to create mutual releases of information and a referral form to ensure that both agencies have exactly what they need by the time the patient arrives, such as medical records and treatment recommendations. One of the common complaints from PCPs is that they have a very difficult time communicating with addiction treatment providers about patients due to strict confidentiality laws. If the patient wants information shared with the PCP, such as confirmation that they attended their initial appointment with the addiction treatment provider, the coordinator can ask about their release of information process and explain to the patient that they will need to fill one out for the PCP. For PCP offices and addiction treatment providers who refer patients often, mutual releases of information can be used to help make this process easier. It is not unusual for a PCP to communicate with a medical specialist about a mutual patient if there is a complicated health issue that they are trying to manage. Speaking with addiction treatment services providers prior to a referral can streamline the process for patients and ensure that their health care is considered and prioritized during their treatment. An effective warm handoff, meaning the patient directly engages with an alcohol use disorder provider, can potentially be more important to the patient's long-term health and wellness than anything else the PCP does.